To rebuild the ACL, we need to take tissue from someplace else in order to make a new ACL. The two main categories that we can use for tissue come from either a cadaver or donor graft, or they can come from your own body. Both options have pros and cons. The cadaver tissue is very attractive in many respects because we're not having to create an injury someplace else in your own body in order to repair the ACL. On the downside, it does have a higher chance of re-tearing in young competitive athletes, and so for people who are under the age of 20, I strongly discourage the use of cadaver grafts unless there's some mitigating circumstances. The two most common sources of your own tissue are either the central third of your patella tendon or one or two of your hamstring tendons. Both are good options. Both have had long histories of success. In some studies, the patella tendon has been shown to have a slightly lower chance of re-tearing, so for many athletes that continues to be the gold standard. For people who want to return to football, basketball, lacrosse, or other high-intensity sports, that's still a fairly popular choice. However, there are some things that are less desirable with the patella tendon. It leaves a broader scar. You can have a little more numbness on the front part of the knee, just lateral or to the side of the incision, which is pretty common with the patella tendon, and a little less common with the hamstring tendon. There's a little higher chance of having persistent pain in the front of the knee, especially with squatting or kneeling activities with the patella tendon than with the hamstring. So for people who are baseball or softball catchers, for example, and have to sit in a kneeled or crouched position for long periods of time, I tend to discourage the use of the patella tendon. People will frequently say, well, if you take my hamstrings or if you take my patella tendon, am I going to be weaker? Am I going to notice a difference in strength? And the answer to that is generally no. People have successfully returned to professional basketball, professional football, and really any other professional sport you can think of with both grafts. So either one has good outcomes. I do a lot of ACL reconstructive surgery, and I'm very comfortable using either the cadaver graft or any of the choices for your own tissue as well. I think it's really important to kind of individualize the graft choice to each particular patient.